Dear viewers, today I'm not going to talk to you about anything pertaining to investments or money matters. These are extraordinary times. World is suffering. There are a lot of people who have come down with COVID-19 infection. For the next 2 or 3 episodes, I am going to talk to you about more about this pandemic. I am trying to research into the past and see if history has any lessons for us. Is there anything that we can learn from this pandemic which have come before? This is NRI Money Clinic for you, and I am Dr. Chandrakanth, Bhat, investment consultant and a financial planner.
NRI Money Clinic. No hype, just the right advice.
Influenza is nothing new to the mankind. Every 100 years, it's said that influenza comes as a pandemic at least 2 to 3 times. It has come many times before. We are passing through one dreaded influenza pandemic at this point of time. What do we learn from the history? About 100 years before, or to be precise, 1918 and 1919, world went through one of the dreaded influenza pandemic in the world. It became popular by name Spanish flu. It was so dreaded that 1/3 of the world population got infected with this influenza. It resulted in loss of enormous human population. It's said that about 3% of the world population died during this influenza outbreak. About 500 million people worldwide, which is about 50 crores in Indian terms, if you have to say, came down with this disease. And about 5 crore people or 50 million people worldwide lost their lives because of this influenza. In India alone, the total death is estimated somewhere between 1 crore to 2 crore people. And India lost 5% of its population because of this influenza epidemic which swept the whole world between 1918 and 1919. The dreaded Spanish flu of 1918 came in waves. There were distinct 3 waves which were separated by months. It started in the spring of 1918. A small wave of influenza swept through. Then it subsided for a while. Then the second wave, which was the deadliest wave of influenza, again came and swept through the world. There was a third wave which came around spring of 1919. Out of these 3 waves, the first wave and the second wave were very, very mild. Not great deal of damage happened during these first and the third wave, whereas the second wave was extremely deadly. Very strange is that population which was above 65 years of age did not get affected by this influenza at all. It is really surprising. People said this could be because of an earlier episode of Russian flu which swept through the US somewhere at the fag end of 19th century, and these elders must have had the immunity against this influenza virus. The second wave of influenza which came in took a big toll on the young population of the world. It affected mainly age group between 20 to 40 and killed a lot of them. The mortality was so huge. In the United States itself, the average life expectancy of people came down by 12 years. It dropped to about 36.6 years for men and to 42.2 years for the women. The intensity of this influenza pandemic could be seen from the number of people who died in the United States. In fact, United States lost more number of people to Spanish flu than the 2 world wars combined and all the recent wars the US has fought. The influenza killed more people than all these wars put together. This epidemic was known as Spanish flu. But this word Spanish flu is a misnomer. Then why did this epidemic was named as Spanish flu? It's because it is Spain which first published its figures in the papers. That's the reason it was known as Spanish flu. What was actually happening was this influenza was spreading all over the world. It was there in France, Germany, United States, and all these war-torn countries. But during the World War I, Spain was a neutral country. The countries which were involved in the war hesitated to publish their figures of influenza deaths that were happening in their troops, and they controlled the press, and the world didn't know about spreading of this influenza at that point of time. Whereas Spain, being a neutral country, it published all its death toll and how the disease was spreading. That's how the word became very popular by name Spanish flu. Otherwise, it has no connection to the Spain as such. So how did the Spanish flu started? Influenza virus has been there all along the human history. It existed everywhere. The virus responsible for this influenza exists in all animal species. As long as it restricts itself to that animal species, we have nothing to worry about. But this is a mutating virus. At times, it's jump species. During Spanish flu, it is said that it moved from pigs to the human beings. The mutant virus, it was called the H1N1 virus. It jumped from pigs and came to human beings. That's how the whole Spanish flu started. There are conflicting theories to see where exactly this flu started. Some say it started in the city of Kansas in the United States. Some people feel it started somewhere in the Far East. From the Far East, along with the troop movements, it came to the United States. Whatever be the case, one thing is certain. The spread of this influenza all around the world was because of the troop movement which happened during the World War. Europe was torn apart due to this World War. It needed men to fight the war. So the influenza which got started in United States along with the troop movement, either by the railroad along the United States or through the ships to other continents of the world, moved into different territories. During that period of time, the World War I was known as the trench warfare. The troops were living in the trenches. They were fighting war from the trenches. These trenches were so marshy places. The troops used to live there. Troops used to live amidst extraordinary conditions of cold, marshiness, and they were staying very close to each other. It's an environment which is perfectly suitable for influenza to spread from one person to the other person, and it spread like the wildfire. The Spanish flu brought chilling stories of sadness. It's a story of hidden information. It's a story of overlooking the warnings given by the health authorities. It's also a story of great governance in some of the places. For example, in case of Philadelphia in United States, the administration totally violated the warnings given by the health authorities. Philadelphia at that point of time was an industrial hotbed. It required a lot of laborers to work in different mills in that area, and it was advertising for laborers at that point of time. In response to that, a lot of people came into Philadelphia. Unfortunately, Philadelphia did not have sufficient place for these laborers to come and stay. The story says that at that point of time, people used to work in different shifts in Philadelphia and they were using the same place to stay. In fact, they were working in different shifts. When one person gets off from the bed, the other person comes and occupies the same bed without even changing the sheets. And this provided a fantastic opportunity for influenza to spread like wildfire. Health authorities had given clear warnings to the administration to do a social distancing. The authorities totally disregarded this and they brought masses to sell the war bonds to generate funds for the war. As a result, Philadelphia was totally torn apart by the casualties which came from this influenza. Philadelphia did not have enough hospitals, it did not have enough nurses. And the intensity of this influenza in that part of the world was so high that anybody who came into the hospitals would have died within next 24 or 48 hours. That doctors and nurses who are treating these patients would come down with the disease within 3 to 4 days of time. The medical hospitals brought in even the first year students who were studying medicine to treat the influenza patients. The number of deaths that were happening because of this influenza created a lot of problems. There were not enough coffins to pack the dead bodies. The authorities decided to mass bury the persons who were suffered from influenza. The cold storage in Philadelphia was used as a morgue at that point of time. Because of this troop movement, the influenza moved to different parts of the world. It came to India via congested ships. It came to the Mumbai dockyard. It affected the dock workers there. From these dock workers, it moved into the civic society. The same way, all along the coastline, influenza started spreading and it killed close to 1 to 2 crore people around this time in India itself. While these are the sad stories, there are good stories also during this influenza outbreak. For example, the governor of San Francisco took very proactive steps to contain the influenza even before the influenza arrived in San Francisco. He imposed strict rules for social distancing, ensured that the social distancing is complete, and San Francisco escaped without much of a damage due to this influenza virus. There are other cases also. For example, there are an island group called Samoa Islands somewhere north of Australia and New Zealand. One portion of Samoa Island was known as the German Samoa, and there were very nearby there is another portion of the island known as the American Samoa. The governor of American Samoa took such action not to allow any ships to come into that American Samoa, and American Samoa did not have any deaths, whereas the German Samoa almost lost half of its population. So what is the lesson to be learned from Spanish flu? It devastated the world, but some parts of the world escaped from influenza. The only thing that was practiced in these areas where influenza did not conquer was the social distancing practiced in those areas. For example, be it in San Francisco or in Samoa Islands or some other parts of the world, those which escaped influenza are the areas which practiced social distancing to the core. 100 years have passed since the Spanish flu hit the world. In these 100 years, our understanding of the disease has increased manifold. Our living standards have improved manifold. Healthcare system around the world has grown in leaps and bounds. But in spite of all this, even today, to survive ourselves from this COVID-19, still the social distancing remains the most suitable method. So when the governments bring in lockdowns, ask us to stay inside our homes, not to meet people, not to gather, let us be very obedient and follow this social distancing to the core, and let's save ourselves and our communities from these ill effects of COVID-19. So dear viewers, if you like the topic that I discussed today, give me a thumbs up. If you have not subscribed to this channel, please hit the subscribe button and press the bell icon. I'll be back with you with one more episode on COVID-19 very, very soon. Thank you very much for watching this episode on NRI Money Clinic.
Press the bell icon for more details and subscribe our channel.